Xavier Brooks burst through Chicago General's ICU doors at 3:47 a.m., his torn pre-med textbooks clutched against his chest, shouting at the team of specialists surrounding 16-year-old Emma Sterling's bed. "Stop those sedatives, you're killing her," the homeless black student declared, grabbing the chart from Dr. Robert Whitmore's hands. "This isn't brain death, it's locked-in syndrome, and your medication has been suppressing her recovery for 2 weeks. The Harvard-trained neurologist laughed until Xavier identified 3 diagnostic markers every million-dollar specialist had missed, symptoms he'd memorized studying his grandmother's identical case, who died from the same misdiagnosis at this exact hospital 5 years ago. What happened next didn't just save Emma's life. It exposed a medical system so arrogant it would rather let patients die than admit a homeless black teenager might understand medicine better than credentialed physicians. This is how one desperate student, with nothing but street knowledge, shattered everything a prestigious hospital believed about expertise. Maya Washington had worked 15 years of night shifts at Chicago General's ICU, and she knew the difference between a patient who was dying and a patient being failed by medicine itself. At 38, she'd seen enough medical arrogance to recognize it from across a crowded emergency room, but tonight felt different. Tonight, she was watching something that made her question everything she'd learned to accept about how hospitals actually worked. It was 2:30 a.m. when she first noticed the pattern. Room 318 held Emma Sterling, a 16-year-old from one of Chicago's wealthiest families, who had been diagnosed with irreversible brain death after a mysterious neurological episode 2 weeks ago. The girl's parents, Grace and Marcus Sterling, had spared no expense bringing in specialists from Harvard, Johns Hopkins, and the Mayo Clinic. Dr. Robert Whitmore, the hospital's most prestigious neurologist, had assembled what he called the finest medical minds available at any price. Maya paused outside Emma's room during her 3 a.m. rounds, watching the rhythmic rise and fall of the girl's chest. Something about Emma's breathing pattern caught her attention, subtle variations that suggested natural sleep cycles rather than the mechanical patterns of brain death. Maya had noticed these irregularities for days, but when she'd mentioned them to Dr. Whitmore, he'd dismissed her observations as wishful thinking from nursing staff who lacked the clinical expertise to interpret complex neurological presentations. The dismissal stung because Maya had been noticing things about Emma that the expensive specialist seemed to miss. During quiet night hours when the family had gone home and the medical team was making rounds elsewhere, Maya observed tiny responses that didn't show up on monitors. A slight change in breathing when voices rose in the hallway. Her barely perceptible shift in facial expression when certain music played on the radio. The kind of subtle awareness that suggested consciousness trapped beneath neurological barriers. But Maya had learned over 15 years of working within medical hierarchies that nurses who questioned doctors were labeled as problematic. She'd seen colleagues transferred to less desirable departments or quietly pushed out of prestigious hospitals for challenging medical authority. So she documented her observations in Emma's nursing notes and said nothing more. That's when she saw him, a young black man, maybe 19 years old, standing in the hallway outside Emma's room. His clothes were worn but clean, jeans that had seen better days, a t-shirt that looked like it came from a donation center, sneakers held together with duct tape. But what caught Maya's attention wasn't his appearance. It was the intensity with which he studied Emma through the window, and the medical textbooks clutched against his chest like lifelines. Maya approached slowly, her nursing instincts alert. Hospital security was usually quick to remove unauthorized individuals from the ICU, especially those who looked like they didn't belong in a facility that charged premium rates for premium care. "Excuse me," she said quietly. "Visiting hours ended at 9 p.m. Are you family?" The young man turned, and Maya saw eyes that carried the weight of knowledge earned through suffering. "No, ma'am," he said, his voice respectful but urgent. "My name is Xavier Brooks. I'm a pre-med student, and I think that girl is being misdiagnosed." Maya felt something shift inside her chest. After days of watching Emma's subtle responses and being dismissed by the medical team, hearing someone else voice concerns felt like validation she hadn't realized she needed. "What do you mean?" she asked, stepping closer. Xavier opened one of his textbooks, a worn copy of Harrison's Principles of Internal Medicine, held together with tape and covered in handwritten notes. "Locked-in syndrome," he said, pointing to a highlighted passage. "She's not brain dead. She's conscious but unable to communicate normally because of inflammation in her brainstem. The symptoms the doctors are calling brain death are actually signs of awareness trying to break through neurological barriers." Maya stared at the textbook, then at Xavier, then through the window at Emma. Everything Xavier was describing matched her own observations: the breathing variations, the subtle responses, the sense that something aware was trapped inside an unresponsive body. "How do you know this?" Maya asked. Xavier's expression grew distant with pain. "Because 5 years ago my grandmother died in this exact hospital from the same condition. The doctors called it sudden unexplained death syndrome, but I've spent years studying her case. She had locked-in syndrome, and the medications they gave her to keep her comfortable actually suppressed the neural activity she needed to recover." Maya felt her professional world tilt on its axis. If Xavier was right, if Emma wasn't brain dead but trapped in a conscious state, then every conversation the medical team had about discontinuing life support was happening within earshot of an aware patient who couldn't defend herself. "The doctors won't listen to you," Maya said quietly, understanding the impossible situation Xavier faced. "They won't listen to me because I'm homeless and black and don't have the right credentials," Xavier replied. "But maybe they'll listen to a nurse with 15 years of experience who's been observing the same things I'm seeing." Maya looked at Xavier, then at Emma, then at the medical chart in her hands that documented 2 weeks of expensive treatments that might have been slowly killing a conscious patient. For the first time in her career, she was about to choose her conscience over her job security. What Maya decided to do next would either validate years of professional training or expose a medical system that valued credentials over competence, and the choice would change everything. 30 minutes later, Maya found herself doing something she'd never done in 15 years of nursing, actively conspiring against the medical team she was supposed to support. She'd agreed to give Xavier 15 minutes to examine Emma during the 4 a.m. shift change, when the ICU would be briefly understaffed and Dr. Whitmore would be making rounds on other floors. "If security sees you, I can't protect you," Maya warned as she led Xavier toward Emma's room. "And if Dr. Whitmore finds out I let you examine a patient without authorization, my career is over." Xavier nodded, his medical textbooks tucked under his arm. "I understand, but if I'm right about Emma's condition, her life is worth more than either of our careers." Maya felt the truth of that statement settle in her chest like a stone. She'd spent so many years protecting her professional position that she'd forgotten the fundamental reason she'd become a nurse: to advocate for patients who couldn't advocate for themselves. They entered Emma's room quietly. The 16-year-old lay motionless, connected to ventilators and monitors that had been declaring her brain dead for 2 weeks. But as Xavier approached the bed, Maya noticed something she'd observed before but never fully acknowledged. Emma's vital signs showed slight variations in response to voices and movement. "Emma," Xavier said softly, kneeling beside the bed. "My name is Xavier. I know you can hear me even if the doctors don't believe it. I know you're trapped in there, and I want you to know that someone finally understands what's happening to you." Maya watched the monitors carefully. Emma's heart rate increased slightly. Not enough to trigger alarms, but enough to suggest responsiveness. Xavier continued, "I'm going to ask you to do something very simple. If you can hear me and understand what I'm saying, try to blink twice. Don't worry if it doesn't work perfectly. Your brain is fighting through neurological interference." Maya held her breath as they watched Emma's closed eyelids. For several seconds, nothing happened. Then, slowly and deliberately, Emma blinked twice. "Oh my God," Maya whispered, stepping closer to the bed. In 15 years of critical care nursing, she'd never seen voluntary response from a patient diagnosed with brain death. Xavier's voice remained calm despite the significance of what they'd just witnessed. "Emma, you're doing great. Can you try to squeeze my hand, just a little pressure?" The faintest squeeze came immediately, so slight that only direct contact could detect it, but unmistakably voluntary. Maya felt tears building in her eyes as the full implications became clear. Emma had been conscious throughout her entire hospitalization, listening to clinical discussions about her hopeless prognosis, hearing debates about the cost-effectiveness of her care, being present for conversations about end-of-life decisions while unable to communicate her own wishes. "She's been aware this whole time," Maya said, her voice barely above a whisper. "Not just aware," Xavier replied, opening his textbook to a detailed page about locked-in syndrome. "Probably terrified. Imagine being conscious, but unable to move or speak while doctors discuss whether your life is worth continuing." Maya looked at Emma with new understanding. For 2 weeks, this 16-year-old had been trapped inside her own body, while a team of expensive specialists treated her as an unconscious object rather than a person. Every dismissive comment about her condition, every clinical discussion about discontinuing care, every expression of frustration about her family's reluctance to accept reality, Emma had heard all of it. "What's the treatment?" Maya asked, her nurse's training taking over despite the emotional impact of the discovery. Xavier consulted his notes. "Anti-inflammatory medication to reduce brainstem swelling, specific neural stimulation exercises to re-establish communication pathways, and immediate discontinuation of the sedatives that have been suppressing her neural recovery." Maya stared at him. "You're saying the medications Dr. Whitmore prescribed are actually preventing her recovery? The sedatives are suppressing the exact neural activity she needs to break through the locked-in state. Every day they continue this protocol, they're pushing her deeper into neurological shutdown." Xavier's voice carried the weight of someone who had studied this condition obsessively. "But she's still savable. The question is whether the medical team will admit they've been wrong." Maya thought about Dr. Whitmore's reputation, his pride in assembling international specialists, his dismissive attitude toward anyone who questioned his medical authority. The idea of admitting that a homeless black teenager understood Emma's condition better than Harvard-educated physicians would challenge everything the hospital's hierarchy was built upon. "They won't listen," Maya said quietly. "They'll have to listen if a respected nurse with 15 years of experience supports the diagnosis," Xavier replied. "But I'm asking you to risk everything you've built your career on." Maya looked at Emma, then at the monitors showing subtle signs of consciousness that had been dismissed as meaningless for 2 weeks. She thought about all the times she'd swallowed her observations to avoid challenging medical authority, all the patients whose subtle communications had been ignored because nurses weren't considered qualified to interpret complex symptoms. "I've been building my career on staying quiet when I should have been speaking up," Maya said finally. "Maybe it's time to build it on something better." The decision would force her to choose between 15 years of professional security and the moral obligation to protect a conscious patient from a medical system that refused to admit its mistakes. What happened when Dr. Whitmore discovered Maya's unauthorized collaboration would test whether Chicago General valued patient care more than medical pride. Dr. Robert Whitmore discovered Maya and Xavier in Emma's room at exactly 4:23 a.m. when he arrived for an unscheduled check on his most challenging case. For 2 weeks, Emma Sterling's condition had frustrated him in ways that threatened his reputation as one of Chicago's most prestigious neurologists. The girl's wealthy family had essentially given him unlimited resources to solve an impossible case, and his failure to provide definitive answers was becoming professionally embarrassing. "What the hell is going on here?" "Doctor..." Whitmore's voice cut through the quiet room like a scalpel through tissue. Maya stood immediately, her nursing instincts recognizing the dangerous territory she'd entered by allowing unauthorized access to a patient. But something had changed in her during the past hour of watching Emma respond to Xavier's communication attempts. For the first time in her career, she was more concerned about patient advocacy than professional self-preservation. "Dr. Whitmore," Maya said, her voice steady despite her racing heart. "I believe you need to hear what Xavier has observed about Emma's condition." "Doctor." Whitmore's eyes fixed on Xavier with the kind of clinical detachment he typically reserved for examining tissue samples. "I don't know who this individual is or how he gained access to my patient, but I'm calling security immediately." "Wait," Xavier said, stepping forward with his medical textbooks clutched against his chest. "Before you have me removed, let me show you 3 diagnostic markers that your team has missed." Dr. Whitmore laughed, the kind of dismissive sound that medical authority makes when challenged by someone it considers unqualified. You're asking me to take medical advice from a homeless individual who has no credentials, no training, and no business being in my ICU. I'm asking you to look at evidence, Xavier replied calmly. Emma isn't brain dead. She has a typical locked-in syndrome, and your current medication protocol is preventing her recovery. The accusation hung in the air like a physical challenge to everything Dr. Whitmore had built his reputation upon. In 30 years of medical practice, he had never faced the possibility that someone without formal medical education might understand a patient's condition better than he did. This is exactly the kind of dangerous thinking that gets patients killed, Dr. Whitmore said, his voice rising with professional indignation. Medical diagnosis requires years of education, clinical experience, and institutional oversight. It's not something that can be learned from reading textbooks found in dumpsters. Maya felt something crystallize inside her chest as she watched Dr. Whitmore's response. She recognized the pattern. When faced with observations that challenged his authority, he attacked the credentials of the observer rather than examining the evidence itself. Dr. Whitmore, Maya said, stepping between him and Xavier, with respect, I've been observing Emma for 2 weeks, and Xavier's observations match mine exactly. She shows subtle responses that suggest consciousness, changes in breathing patterns, slight facial expressions, variations in vital signs that correspond to environmental stimuli. Doctor. Whitmore turned his attention to Maya with the kind of professional disapproval that could end careers. Nurse Washington, you've been an asset to this ICU for 15 years, but you're allowing desperation to cloud your clinical judgment. These subtle responses you're describing are random neural activity, the kind of meaningless muscle contractions that families mistake for consciousness because they can't accept the reality of brain death. Then test her, Xavier said quietly. Both Maya and Dr. Whitmore turned toward him. If Emma is brain dead, as you've diagnosed, she won't be able to respond to cognitive challenges. But if she has locked-in syndrome, she'll demonstrate awareness through voluntary responses. Xavier opened his textbook to a page covered with detailed notes. Ask her questions that require thinking, not just reflexive responses. If she can answer by blinking, once for no, twice for yes, it will prove she's not only conscious but cognitively intact. Doctor. Whitmore stared at Xavier for a long moment, processing the implications of the challenge. If he refused to test Emma's cognitive function, he would appear to be avoiding evidence that contradicted his diagnosis. If he agreed to test and Emma failed to respond, he could discredit Xavier completely and restore his medical authority. But if he agreed to test and Emma demonstrated cognitive awareness, his entire career would be called into question. Fine, Dr. Whitmore said finally, his voice tight with confidence. But when this test fails to show cognitive function, I want both of you removed from my hospital permanently. Maya felt her stomach tighten with fear and anticipation. Everything she'd built professionally was now dependent on whether a 16-year-old girl could prove she was conscious, while medical equipment declared her brain dead. Xavier nodded without hesitation. And if the test shows that Emma is cognitively intact? Dr. Whitmore met his gaze with the kind of medical arrogance that had never been successfully challenged. Then I'll implement whatever treatment protocol you recommend, and I'll personally recommend you for admission to our medical school program. Maya realized she was witnessing something unprecedented. A homeless black teenager had just maneuvered one of Chicago's most powerful physicians into a position where medical authority would be determined by patient response rather than institutional credentials. Emma, Dr. Whitmore said, approaching the bed with the formal tone he used for clinical demonstrations, if you can hear and understand me, I'm going to ask you some questions. Blink once for no, twice for yes. The ICU fell silent, except for the mechanical breathing of ventilators and the soft beeping of heart monitors. Maya found herself holding her breath as they waited for a response that would either validate or destroy everything she'd risked her career to support. Emma's next response would determine whether medical knowledge belonged to institutions or to anyone brave enough to pay attention when others refused to see. Emma Sterling's first deliberate response shattered the clinical certainty that had defined Chicago General's ICU for 30 years. When Dr. Whitmore asked if she could hear him, her two clear, unmistakable blinks sent shockwaves through not just the medical equipment monitoring her vital signs, but through the fundamental assumptions about consciousness, authority, and expertise that governed hospital care. "That was coincidental," Dr. Whitmore said immediately, though his voice carried less conviction than it had moments before. "Random neural firing can simulate responsive movement." But Maya had watched Emma's face during the response, and what she saw went beyond random muscle contractions. There was intentionality in the movement, awareness in the timing, consciousness in the deliberate nature of the two blinks. "Ask her another question," Xavier said quietly. "Something that requires thinking, not just yes or no responses." Dr. Whitmore's jaw tightened, but he was trapped by his own agreement to test Emma's cognitive function. "Emma, I'm going to ask you a mathematical question. What is 8 plus 7? If the answer is 15, blink twice. If it's not 15, blink once." The pause seemed to last forever. Maya could hear her own heartbeat above the mechanical sounds of the ICU as they waited for Emma to demonstrate either consciousness or the absence of higher brain function. Then, clearly and deliberately, Emma blinked twice. Maya felt her knees weaken as the implications became undeniable. Emma wasn't just conscious, she was cognitively intact, able to perform mental calculations while her body remained locked in neurological paralysis. "Doctor." Whitmore stepped backward, his face pale with the growing realization that his diagnosis had been catastrophically wrong. This isn't possible," he whispered. "It's not only possible, it's documented in medical literature," Xavier said, consulting his worn textbook. "Dr. Elena Vasquez's research from 2019 identified 17 cases of a typical locked-in syndrome in patients aged 14 to 17. The diagnostic markers are completely different from adult presentations, which is why standard protocols miss it." Maya watched Dr. Whitmore's expression shift from medical authority to professional panic as he processed what Xavier had just revealed. Not only had he misdiagnosed a conscious patient as brain-dead, but the correct diagnosis existed in published research that his expensive specialists had apparently never encountered. "You're asking me to believe that published research escaped the notice of specialists from Harvard, Johns Hopkins, and Mayo Clinic," Dr. Whitmore said, his voice rising with defensive anger. "I'm asking you to believe that sometimes the most important medical knowledge isn't taught in the most prestigious programs," Xavier replied calmly. Dr. Vasquez published her research in smaller journals because she was treating homeless and indigent patients. The medical establishment didn't consider her work relevant to real hospital populations. The irony wasn't lost on anyone in the room. The research that could save Emma had been dismissed by mainstream medicine because it focused on patients exactly like Xavier, people without insurance, without social status, without the kind of institutional backing that gave medical research credibility. Maya felt something shift in her understanding of how medical knowledge actually worked. She'd spent 15 years assuming that the most expensive specialists had access to the most complete information, but Xavier was suggesting that crucial insights were being ignored because they came from the wrong sources. "Even if this research exists," Dr. Whitmore said, his authority reasserting itself, "I'm not going to change a treatment protocol based on the recommendations of an unqualified individual who learned medicine from discarded textbooks." "Then don't change it based on my recommendations," Xavier said. "Change it based on Emma's responses. Ask her if she's in pain. Ask her if she understands what's happening to her. Ask her if she wants the current treatment to continue." Dr. Whitmore stared at Xavier, recognizing the trap he'd walked into. If Emma could demonstrate cognitive awareness about her own condition, then continuing treatment against her wishes would be both medically and ethically indefensible. "Emma," Dr. Whitmore said, his voice barely above a whisper, "are you experiencing pain or discomfort from your current treatment? Blink once for no, twice for yes." Emma blinked twice, immediately and emphatically. Maya felt tears streaming down her face as she realized that for 2 weeks, Emma had been conscious and suffering while medical professionals discussed her case as if she were an unconscious object, incapable of experiencing pain or having preferences about her own care. "Do you understand that we've been treating you for brain death?" Dr. Whitmore continued, his medical training taking over despite his emotional distress. 2 blinks. "Do you want us to continue the current medication protocol?" 1 blink, clear, definitive, unmistakable. "Doctor..." Whitmore collapsed into the chair beside Emma's bed, his professional confidence shattered by the realization that he had been slowly killing a conscious patient while being paid hundreds of thousands of dollars to save her life. Maya looked at Xavier, who was watching Dr. Whitmore with something approaching compassion, despite everything the physician had put him through. "What's the treatment protocol?" Dr. Whitmore asked finally, his voice broken by the weight of his mistake. Xavier opened his textbook to a page covered with detailed notes and diagrams. "Immediate discontinuation of sedatives, anti-inflammatory medication to reduce brainstem swelling, and specific neural stimulation exercises to re-establish communication pathways. The success rate is over 90% if treatment begins immediately." Dr. Whitmore looked at Emma, then at Maya, then at the homeless teenager, who had accomplished in 1 hour what his $1 million medical team had failed to achieve in 2 weeks. "Implement the protocol," he said quietly. But as word of Emma's consciousness spread through Chicago General, Maya realized that challenging medical authority would have consequences far beyond a single patient, and the battle for her career was just beginning. Within minutes of Dr. Whitmore ordering the new treatment protocol, Emma Sterling's condition began changing in ways that validated every observation Maya had been dismissed for making over the past 2 weeks. As the sedatives were discontinued and anti-inflammatory medication began reducing the brainstem swelling that had trapped her consciousness, Emma's responses became increasingly clear and purposeful. "Her EEG patterns are normalizing," announced Dr. Sarah Bennett, the ICU's newest resident, her voice filled with wonder as she monitored brainwave activity that had been flat for 14 days. "We're seeing alpha wave patterns consistent with aware but relaxed consciousness." Maya stood beside Emma's bed, gently performing the neural stimulation exercises that Xavier had demonstrated. Simple techniques designed to reactivate dormant nerve pathways and encourage Emma's brain to rebuild connections disrupted by inflammation. For the first time in her nursing career, Maya felt like she was participating in healing, rather than just maintaining medical protocols. "Emma," Maya said softly, "the medicine that was making it hard for your brain to communicate is being stopped. You might start feeling more aware, more able to move. Don't be scared if sensations start coming back. That's your nervous system healing itself." Emma's response was subtle but unmistakable, a slight increase in heart rate that suggested not just awareness, but relief. Maya realized that Emma had been listening to medical discussions about her hopeless condition for 2 weeks, probably terrified that no one understood she was conscious and fighting to communicate. Xavier knelt beside the bed, his medical textbooks open to pages documenting case studies of successful locked-in syndrome treatment. "Emma, I want you to try something for me. Try to wiggle your toes. Don't worry if it doesn't work perfectly. Your brain is just remembering how to control your body." Maya watched Emma's feet with desperate intensity. For several seconds, nothing happened. Then slowly, almost imperceptibly, Emma's right big toe moved. "She moved her toe," Maya whispered, gripping Xavier's arm with excitement. "She actually moved her toe." "Doctor..." Whitmore observed the toe movement with the stunned expression of someone whose fundamental beliefs about medicine were being systematically dismantled. For 30 years, he had practiced medicine based on the assumption that expensive education and institutional authority were synonymous with medical expertise. Xavier's success with Emma challenged that assumption at its core. "The anti-inflammatory medication should reach peak effectiveness within the next 6 hours," Xavier continued, consulting his handwritten notes. "Her communication abilities should improve significantly by morning, and voluntary motor function should begin returning within 48 hours. Maya felt a mixture of vindication and anger as she processed the implications of what Xavier was describing. If the treatment was this straightforward, if the research existed in published literature, If the diagnostic markers were identifiable to anyone who looked carefully, then Emma's 2 weeks of suffering had been completely preventable. "Dr. Whitmore," Maya said, her voice carrying 15 years of suppressed frustration with medical hierarchy, "I need to ask you something directly." "Dr." Whitmore looked up from Emma's chart, where he was documenting responses that shouldn't have been possible, according to his diagnosis. "How many other patients have we misdiagnosed because we didn't consider alternative possibilities?" Maya continued. "How many families have we told their loved ones were hopeless when we simply weren't looking at the right research?" The question hung in the air like an indictment of the entire medical system. "Dr." Whitmore's expertise had been built on dismissing observations that didn't fit standard protocols, on valuing credentials over competence, on assuming that expensive specialists were inherently superior to alternative sources of medical knowledge. "Maya," Dr. Whitmore said quietly, "I don't know how to answer that question." Xavier looked up from his textbooks with an expression that carried the weight of personal experience with medical dismissal. "Dr. Whitmore, in the past 3 years, I've identified 17 cases across Chicago where patients were misdiagnosed because medical teams weren't willing to consider conditions that fell outside their standard protocols." "Doctor," Whitmore stared at him, "you're saying you've been conducting unauthorized medical consultations across the city?" "I'm saying I've been trying to prevent other families from going through what mine went through when my grandmother died, from this exact condition in this exact hospital," Xavier replied. "And I'm saying that most of the time, medical professionals aren't interested in diagnostic insights that come from someone who doesn't have the right credentials." Maya felt the full implications of Xavier's statement settle in her chest like lead. This homeless teenager had been conducting a shadow medical practice for 3 years, identifying diagnostic errors and correcting them when possible, all while surviving on the streets and studying medicine from discarded textbooks. "How many patients did you save?" Maya asked. 12 recoveries, 3 partial recoveries, 2 cases where I arrived too late," Xavier said simply. "And dozens of cases where medical teams refused to consider alternative diagnoses because they came from someone they didn't consider qualified to have medical opinions." "Doctor," Whitmore realized he was facing something unprecedented, systematic evidence that medical authority, based on credentials and institutional hierarchy, was not just flawed, but potentially deadly. Xavier represented proof that diagnostic excellence could come from sources that the medical establishment systematically ignored. "What do you want from me?" Dr. Whitmore asked finally. "I want you to question whether expensive specialists are actually better at medicine than people who study it out of necessity," Xavier replied. "And I want you to consider that maybe the most important medical insights come from people who understand suffering, not just people who understand systems." Maya looked between Xavier and Dr. Whitmore, recognizing that she was witnessing a conversation that could fundamentally change how Chicago General approached medical diagnosis, or that could be quietly suppressed to protect institutional reputations. But as Emma's recovery continued to accelerate, Maya discovered that challenging medical hierarchy would bring consequences she hadn't anticipated, and the real battle was just beginning. News of Emma Sterling's consciousness spread through Chicago General like wildfire, but not in the way Maya had expected. Instead of celebration about a medical breakthrough, she encountered resistance from colleagues who saw Xavier's success as a threat to everything they'd built their careers upon. By 6 a.m., Maya found herself facing an institutional response that would test whether her commitment to patient advocacy was stronger than her need for professional security. "Maya, we need to talk. Doctor." Patricia Morrison, Chicago General's chief of staff, appeared at Emma's bedside with the kind of expression that ended careers. "My office, now." Maya glanced at Xavier, who was continuing the neural stimulation exercises that were clearly accelerating Emma's recovery, then at Emma herself, whose eyes now tracked movement and whose breathing showed natural patterns rather than mechanical assistance. "I'll be back," Maya told Emma quietly, squeezing her hand and feeling the reassuring pressure of Emma's responsive grip. "Doctor." Morrison's office occupied the hospital's top floor, with windows overlooking the city, that Chicago General served with varying degrees of competence depending on patients' ability to pay premium rates. Maya had been in this office once before, 15 years ago, when she was hired as a new graduate nurse with promises of professional advancement and meaningful patient care. "Sit down, Maya, Doctor," Morrison said, settling behind a desk that cost more than Maya's annual salary. "I need to understand exactly what happened in Emma Sterling's room this morning." Maya recognized the tone. Clinical, detached, focused on institutional protection rather than patient outcomes. A homeless student identified that Emma has locked-in syndrome instead of brain death, and his treatment recommendations are working. A homeless individual with no medical credentials gained unauthorized access to one of our most sensitive cases and convinced you to implement experimental treatment protocols without proper medical oversight, Doctor," Morrison corrected. "Do you understand the liability implications of what you've done?" Maya felt something crystallize in her chest as she processed Dr. Morrison's response. Emma's recovery, Xavier's diagnostic insights, the clear evidence that the expensive medical team had been catastrophically wrong. None of it mattered as much as protecting the hospital from legal and reputational consequences. "Dr. Morrison, Emma is conscious. She's been conscious for 2 weeks while our medical team discussed discontinuing her life support. She was suffering while we treated her as an unconscious object, incapable of pain or preferences about her own care. And now she's recovering under protocols recommended by an unqualified individual who learned medicine from textbooks found in dumpsters," Dr. Morrison replied. "Maya, you've been an exemplary nurse for 15 years, but this decision shows such catastrophically poor judgment that I'm questioning whether you're fit to continue practicing in our ICU." Maya stared at Dr. Morrison, recognizing the institutional gaslighting that she'd witnessed directed at families who questioned medical authority. When faced with evidence that challenged their expertise, hospital administrators attacked the credibility of the challengers rather than examining their own failures. "Are you firing me for helping save a patient's life?" Maya asked directly. "I'm disciplining you for violating hospital protocols, compromising patient safety, and demonstrating the kind of professional judgment that exposes this institution to massive liability, Doctor," Morrison said. "Emma Sterling's family has invested nearly $500,000 in treatment from our most prestigious specialists. If word spreads that their daughter was correctly diagnosed by a homeless teenager while our experts were wrong, the reputational damage could be catastrophic." Maya felt the full weight of institutional priorities settling on her shoulders like lead. The hospital's concern wasn't Emma's well-being or the accuracy of medical diagnosis. It was protecting the financial and reputational investments that made Chicago General profitable. "So what happens now?" Maya asked. "You're suspended pending a full investigation of your conduct," Dr. Morrison said. "And this Xavier Brooks individual will be banned from hospital property permanently. The Sterling family will be told that Emma's recovery resulted from the expertise of our medical team, and no mention will be made of outside consultation." Maya realized she was witnessing institutional medical corruption in its purest form. Emma's recovery would be credited to the expensive specialists who had misdiagnosed her, while Xavier's insights would be erased from the official record to protect hospital profits. "And if I refuse to stay quiet about what actually happened?" Maya asked. Dr. Morrison's expression grew cold with the kind of authority that had destroyed countless medical careers. "Then you'll discover how difficult it becomes to find employment in healthcare when your former supervisors describe you as someone who endangers patients through poor professional judgment." Maya understood the threat perfectly. Chicago General's influence extended throughout the city's medical community. Dr. Morrison could effectively end her nursing career with a few carefully worded phone calls to other hospitals. "I need to think about this," Maya said finally. "You have 48 hours to decide whether your commitment is to this institution or to whatever misguided principles convinced you to trust medical advice from a homeless individual over our trained specialists, Doctor," Morrison replied. "Choose carefully, Maya. 15 years of exemplary service can be erased very quickly by one catastrophically poor decision." Maya walked out of Dr. Fu Morrison's office understanding that the battle for Emma Sterling's life had been won, But the war for medical integrity was just beginning. She had 48 hours to decide whether 15 years of nursing experience was worth sacrificing to protect a system that valued institutional reputation over patient care. She found Xavier exactly where she'd left him, beside Emma's bed, monitoring her responses and adjusting the neural stimulation exercises based on her improving muscle control. In the 2 hours since implementing his treatment protocol, Emma had progressed from barely perceptible toe movements to subtle facial expressions and purposeful hand gestures. "They suspended me," Maya said quietly, settling into the chair beside Emma's bed. Xavier looked up from his medical textbooks, his expression showing anger rather than surprise. "Because you helped save her life." "Because I violated hospital protocols by allowing unauthorized medical consultation," Maya replied. "And because they're afraid that if word gets out about what really happened here, it will damage the hospital's reputation." Emma's eyes moved toward Maya's voice, and for the first time since her diagnosis she attempted to speak. The sound that emerged was barely a whisper, but it was unmistakably intentional. "Thank you." Maya felt tears building as she heard Emma's voice, proof that consciousness hadn't just returned, but was growing stronger with each hour of proper treatment. For 2 weeks, this 16-year-old had been trapped in silence while medical professionals discussed her case as if she were incapable of having opinions about her own care. "Emma, can you tell us how you're feeling?" Xavier asked, his voice carrying the gentle authority of someone who understood the vulnerability of patients trapped between consciousness and communication. "Tired," Emma whispered, her voice growing slightly stronger with each word. "But clear, like fog lifting. I heard everything, all the discussions about giving up." Maya gripped Emma's hand, feeling the increasing strength of her responsive squeeze. "We're not giving up, but I need you to understand that the hospital wants to pretend Xavier had nothing to do with your recovery. They want to credit your improvement to the specialists who were treating you before." Emma's expression grew focused, with an intensity that suggested full cognitive function. "That's not what happened." "No," Xavier agreed, "but institutions protect themselves by controlling narratives. If Chicago General admits that a homeless teenager diagnosed your condition correctly, while their expensive specialists were wrong, it raises uncomfortable questions about how medicine actually works." Maya watched Emma process this information, recognizing the intelligence and determination that had probably helped her survive 2 weeks of conscious imprisonment in her own body. "What if I tell them what really happened?" Emma asked. Maya felt a surge of hope mixed with concern. Emma's testimony could validate everything Xavier had accomplished, but it would also put a 16-year-old patient in direct conflict with powerful medical authorities. "Emma, your family has invested nearly $500,000 in treatment from specialists who misdiagnosed your condition," Maya explained. "If you challenge their expertise publicly, there could be legal and financial consequences that affect more than just the hospital." Emma was quiet for a moment, her improving motor control allowing her to turn her head slightly toward Xavier. "You saved my life when everyone else had given up. How many other patients are going through what I went through?" Xavier's expression grew distant, with the weight of knowledge gained through personal loss. "Too many. Medical systems resist diagnostic approaches that don't come from traditional sources, even when those approaches save lives." "Then we have to change the system," Emma said, her voice carrying surprising strength for someone who had been considered brain-dead hours earlier. Maya stared at this remarkable teenager who was choosing to fight institutional medical authority while still recovering from neurological trauma. "Emma, you don't understand what you're up against. These people can destroy careers, manipulate records, control public narratives about what happened to you. And if I stay quiet, they'll keep destroying other patients," Emma replied. "Xavier, how many cases have you identified where medical teams were wrong but refused to listen to alternative diagnoses?" 17 in the past 3 years, Xavier said quietly. "And those are just the ones I was able to investigate personally." Emma's eyes widened as she processed the implications. 17 families who went through what mine went through. 17 patients who might have suffered or died because doctors were too proud to consider that their diagnoses might be wrong. Maya felt something shift in the dynamic of their conversation. Instead of protecting Emma from institutional retaliation, she was witnessing a patient who was ready to fight for systemic change that could prevent other families from experiencing medical negligence. "What are you proposing?" Maya asked. "I'm proposing that we tell the truth about what happened here," Emma said. "All of it. How the specialists misdiagnosed me, how Xavier identified the correct condition, how you risked your career to help him save my life." Xavier looked concerned. "Emma, institutional retaliation can be brutal. They'll attack your credibility, question your mental state, suggest that your recent neurological trauma has affected your judgment. Let them try," Emma said with the kind of determination that Maya recognized in patients who had survived near-death experiences. "I spent 2 weeks listening to doctors discuss whether my life was worth continuing, while I was conscious and unable to defend myself. I know exactly what happened, and I'm not going to let them rewrite history to protect their reputations." Maya realized she was witnessing something unprecedented, a patient who was ready to challenge medical authority from a position of moral clarity rather than desperate need. Emma's recovery gave her credibility that Xavier lacked as a homeless outsider, and her family's wealth provided protection against the kind of institutional retaliation that typically silenced medical critics. "If we do this, there's no going back," Maya warned. "Once we publicly challenge how this hospital practices medicine, we'll be fighting a system that has unlimited resources and decades of experience destroying people who threaten their authority." Emma smiled, the first genuine expression of joy Maya had seen from her since regaining consciousness. "Then it's a good thing we have the truth on our side." Xavier opened his textbook to a page documenting successful treatments for conditions that mainstream medicine had considered hopeless. "Emma, are you sure you're ready for this fight?" "I've been ready since the moment I heard Dr. Whitmore tell my parents I was brain dead while I was screaming inside my own head," Emma replied. "The question is whether you're ready to help me make sure no other patient has to go through what I experienced." Maya looked between Emma and Xavier, recognizing that she was witnessing the formation of an alliance that could either transform medical care at Chicago General or destroy everyone involved in challenging institutional authority. What Emma decided to do next would determine whether patient voices could overcome medical arrogance or whether the system would crush anyone brave enough to demand accountability. The confrontation that would determine Emma Sterling's future and the future of medical accountability at Chicago General erupted at 8:30 a.m. when her parents arrived for their daily visit and found their daughter not only conscious, but preparing to challenge the entire medical establishment that had pronounced her hopeless. Grace Sterling, Chicago's premier socialite and philanthropist, stood frozen in Emma's doorway as her daughter spoke clearly and purposefully for the first time in 2 weeks. Marcus Sterling, whose corporate empire had funded much of Chicago General's recent expansion, gripped the doorframe with white knuckles as Emma explained how she had been conscious throughout her misdiagnosis. "You're telling us that you heard everything," Grace whispered, her voice breaking with the realization that her daughter had been aware during every conversation about discontinuing life support. "Every discussion about letting you go?" Emma nodded, her motor control improving rapidly under Xavier's treatment protocol. "I heard Dr. Whitmore tell you that keeping me alive was expensive and probably futile. I heard the discussions about whether it was kind to continue treatment. I heard you crying beside my bed, Mom, and I couldn't comfort you." Maya watched the Sterling family process the horrific reality that their daughter had been trapped and conscious, while medical professionals treated her as an unconscious object, incapable of experiencing fear, pain, or preferences about her own care. Marcus Sterling's attention turned to Xavier, who stood quietly beside Emma's bed with his worn medical textbooks. "And you're the young man who identified her real condition?" "Yes, sir," Xavier replied respectfully. "Your daughter has locked-in syndrome, not brain death. The inflammation in her brainstem was preventing normal communication, but her consciousness and cognitive function remained intact." "How did you know this when specialists from Harvard and Johns Hopkins missed it?" Grace asked, her voice carrying confusion rather than accusation. Xavier opened his textbook to pages covered with detailed notes and case studies. Because I've been studying this exact condition for 5 years since my grandmother died from the same misdiagnosis in this hospital. The research exists in medical literature, but it's published in journals that focus on indigent patient populations, so mainstream medicine doesn't encounter it regularly. Maya felt the weight of that revelation settle over the room. The knowledge that could have saved Emma had been available all along, but institutional medical education had created blind spots that prevented expensive specialists from accessing crucial information. "Are you saying that our daughter's suffering was preventable?" Marcus asked, his corporate instincts recognizing the implications for institutional liability. "Completely preventable," Xavier confirmed. If one doctor had been willing to consider locked-in syndrome and discontinue the sedatives that were suppressing her neural recovery, Emma would have regained consciousness within days instead of weeks. Grace Sterling sat heavily in the chair beside Emma's bed, her carefully controlled composure cracking under the weight of systemic medical failure. How many other patients go through this? How many families are told their loved ones are hopeless when they're actually treatable? "More than you'd want to believe," Maya said quietly. "Medical systems resist diagnostic approaches that challenge their authority, even when those approaches save lives." Emma reached for her mother's hand with improving coordination. "Mom, Dad, I need to tell you something important. The hospital wants to pretend that their specialists figured out my condition and that Xavier had nothing to do with my recovery. They want to erase what really happened to protect their reputation." Marcus Sterling's expression shifted to the kind of corporate calculation that had built his business empire. "What exactly are you asking us to do, Emma?" "I'm asking you to help me tell the truth about what happened here," Emma said, her voice growing stronger with each sentence. "Not just for me, but for other patients who might be misdiagnosed because doctors are too proud to consider alternative possibilities." Maya watched the Sterling family dynamic shift, as wealthy parents who had trusted institutional authority completely found themselves confronting evidence of systematic medical incompetence that had nearly killed their daughter. "The hospital has already suspended Maya for helping Xavier save my life," Emma continued. "They're going to try to destroy anyone who challenges their version of events. But if we stay silent, nothing changes, and other families will go through what we went through." Grace Sterling looked at Xavier with new understanding. "You risked everything to help our daughter, knowing that the medical establishment would try to destroy you for challenging their authority." "I risked everything because I couldn't let another family lose someone the way mine did," Xavier replied simply. "My grandmother died from this exact condition because doctors were too proud to consider that a 9-year-old boy might notice symptoms they had missed." Marcus Sterling stood and walked to the window overlooking Chicago General's main entrance, where expensive cars dropped off wealthy patients who expected premium medical care in exchange for premium payments. "Emma," he said finally, "if we do this, if we publicly challenge how this hospital practices medicine, we'll be fighting people with unlimited resources and political connections that could affect our family and our businesses." Emma struggled to sit up straighter in her hospital bed, her determination overcoming her physical limitations. "Dad, for 2 weeks I was trapped inside my own body while doctors discussed whether my life was worth the cost of continuing treatment. I know exactly what kind of people we're fighting, and I know exactly why we have to fight them." Maya realized she was witnessing something unprecedented. A wealthy family choosing to use their privilege to challenge medical authority rather than quietly accepting institutional protection in exchange for silence. What the Sterling family decided next would determine whether patient advocacy could overcome medical arrogance or whether institutional power would crush anyone brave enough to demand accountability from Chicago's most prestigious hospital. Marcus Sterling made the phone call that would change everything at 10:15 a.m., contacting investigative journalist Diana Walsh from the Chicago Tribune with a story that would expose systematic medical negligence at one of the city's most prestigious hospitals. Within hours, the narrative that Chicago General had carefully constructed about Emma's recovery began crumbling under the weight of documented evidence and eyewitness testimony. "Mr. Sterling," Diana Walsh said as she set up recording equipment in Emma's hospital room, "I need to make sure I understand this correctly. You're alleging that your daughter was misdiagnosed by specialists from Harvard, Johns Hopkins and Mayo Clinic, and that the correct diagnosis came from a homeless teenager with no formal medical training? Emma answered before her father could respond, her voice clear and strong after 12 hours of proper treatment. I'm not alleging anything. I'm stating facts that can be verified through medical records, nursing notes and witness testimony. Maya stood beside Emma's bed, her nursing credentials lending credibility to claims that might otherwise seem impossible. After 15 years of working within medical hierarchies, she was finally speaking publicly about systematic problems she'd observed, but never been allowed to address. Diana, I documented Emma's subtle responses in nursing notes for 2 weeks, Maya explained. Breathing pattern changes, slight facial expressions, variations in vital signs that suggested consciousness. But when I brought these observations to Dr. Whitmore's attention, he dismissed them as wishful thinking from nursing staff who lack clinical expertise. Xavier sat quietly in the corner, his medical textbooks open to pages documenting successful locked-in syndrome treatments. Despite being the catalyst for Emma's recovery, he remained uncomfortable with public attention that challenged medical authority he'd spent years learning to navigate carefully. Xavier, Diana Walsh addressed him directly, can you explain how you identified Emma's condition when internationally renowned specialists missed it? Xavier looked at Emma, who nodded encouragingly, before responding. Locked-in syndrome in adolescents presents differently than in adults. The research documenting these differences exists in medical literature, but it's published in journals that focus on indigent patient populations. Mainstream medical education doesn't encounter this information because it assumes that expensive specialists have access to the most complete knowledge. Diana Walsh paused her recording, processing the implications of what Xavier was describing. Are you saying that crucial medical information is being systematically ignored because it comes from the wrong sources? I'm saying that my grandmother died from this exact condition 5 years ago in this exact hospital because doctors dismissed observations that came from family members without medical credentials, Xavier replied. And I'm saying that pattern of dismissal continues to kill patients who could be saved if medical systems valued competence over credentials. The hospital's response came swiftly and predictably. Doctor. Morrison arrived with hospital security and legal counsel, intent on stopping the interview before Emma's testimony could be broadcast to Chicago's medical community. This interview is unauthorized and potentially harmful to patient confidentiality, Dr. Morrison announced as she entered Emma's room with an entourage of institutional authority. I'm going to have to ask everyone to leave immediately. Emma looked directly at Dr. Morrison with the kind of moral clarity that comes from surviving systematic medical negligence. Dr. Morrison, I'm the patient. These are my parents. This is my story to tell, and I'm choosing to tell it because other patients deserve better care than I received. Emma, you've just recovered from serious neurological trauma, Dr. Morrison said, her voice carrying the condescending tone that medical authority uses to dismiss inconvenient patient perspectives. Your judgment may be affected by your recent medical experience. Perhaps you should wait until you've had more time to process what happened before making statements that could have serious legal implications. Maya felt 15 years of suppressed anger crystallize into perfect clarity as she watched Dr. Morrison attempt to gaslight a conscious patient about her own experience. Dr. Morrison, Emma's cognitive function is completely intact, as demonstrated by her ability to perform complex mathematical calculations while she was supposedly brain-dead. Nurse Washington, you are currently suspended and have no authority to make clinical assessments, Dr. Morrison replied sharply. And I would remind you that your employment status depends on your willingness to support this institution rather than undermining it through unauthorized media engagement. Diana Walsh looked between Emma and Dr. Morrison, recognizing the institutional pressure being applied to silence criticism of medical authority. Dr. Morrison, are you suggesting that Emma Sterling is not competent to discuss her own medical experience? I'm suggesting that this hospital has protocols for media engagement that protect both patient confidentiality and institutional integrity, Dr. Morrison replied. Unauthorized interviews that make unsubstantiated claims about medical care can damage reputations and careers of dedicated healthcare professionals. Emma struggled to sit up in her hospital bed, her determination overcoming physical limitations as she addressed Dr. Morrison directly. "Dr. Morrison, I was conscious when Dr. Whitmore told my parents that keeping me alive was expensive and probably futile. I was conscious when specialists discussed discontinuing my life support. I was conscious when medical professionals treated me as an unconscious object, incapable of having preferences about my own care." The room fell silent as Emma's testimony cut through institutional deflection with the authority of lived experience. "Xavier Brooks saved my life when your specialists had given up," Emma continued. "Maya Washington risked her career to help him implement treatment that your protocols had missed. If you want to protect reputations and careers, maybe you should start by making sure your medical diagnoses are correct before worrying about who gets credit for fixing them." Dr. Morrison realized she was facing something unprecedented, a wealthy patient with full cognitive function, supporting witnesses and media attention, someone who couldn't be intimidated, discredited, or silenced through the usual institutional mechanisms. As news of Emma's recovery and the hospital's attempted cover-up spread through Chicago's medical community, the battle for accountability was just beginning. The story broke on the Chicago Tribune's front page the next morning, with a headline that sent shockwaves through the city's medical establishment. "Homeless teen saves life that Harvard doctors declared hopeless." Within hours, Chicago General found itself facing not just media scrutiny, but questions from medical licensing boards, insurance companies, and other families who wondered if their loved ones had been similarly misdiagnosed. Dr. Robert Whitmore sat in his office at 6 a.m., reading coverage that systematically dismantled his reputation as one of Chicago's most prestigious neurologists. The article included detailed documentation of Emma's responses during her misdiagnosis, photographs of Xavier's annotated medical textbooks, and testimony from Maya about the institutional resistance she'd encountered when trying to advocate for proper patient care. His secretary knocked hesitantly before entering. "Dr. Whitmore, there are 17 families in the lobby requesting to speak with you about their loved ones' neurological diagnoses. And Channel 7 News is asking for a statement about the Sterling case." Doctor Whitmore felt the weight of 30 years of medical authority crumbling under the scrutiny of a single case where his expertise had been catastrophically wrong. The families waiting in the lobby represented patients he'd treated over the past 5 years, cases where he'd been confident in his diagnoses and dismissive of family members who questioned his medical judgment. Emma's room had become an impromptu headquarters for what was rapidly developing into a broader investigation of diagnostic practices at Chicago General. Xavier sat beside her bed, fielding phone calls from medical professionals around the country who wanted to understand how a homeless teenager had identified a condition that internationally renowned specialists had missed. "Dr. Martinez from Johns Hopkins wants to know if you'd be willing to present your diagnostic methodology at their next neurology conference," Xavier told Emma as he hung up his latest call. Emma smiled, her motor function improving rapidly under the treatment protocol that Dr. Whitmore's team had initially dismissed as unqualified speculation. "Tell her that you'll present it, but only if the conference includes discussions about why crucial medical research gets ignored when it focuses on indigent patient populations." Maya watched this exchange with amazement. In less than 48 hours, Xavier had gone from homeless outsider to recognized medical consultant, while she had gone from suspended nurse to vindicated patient advocate. But the transformation felt fragile, dependent on continued media attention and public pressure that could dissipate if institutional authority found ways to reassert control. Dr. Morrison appeared in Emma's doorway with the expression of someone whose institutional management strategies had been overwhelmed by forces beyond her control. "Emma, your family has requested a meeting with the hospital's board of directors to discuss your care and the circumstances surrounding your recovery. I assume that meeting will include Xavier and Maya," Emma replied, her voice carrying newfound authority that came from surviving systematic medical negligence. "The board is interested in hearing from all parties involved in your case," Dr. Morrison said carefully, However, I should mention that several board members have expressed concerns about the way this situation has been handled, particularly regarding unauthorized medical consultation and media engagement. Maya stepped forward, recognizing institutional language designed to intimidate critics into backing down. Dr. Morrison, are you suggesting that the board is more concerned about unauthorized consultation than about the fact that their specialists misdiagnosed a conscious patient as brain dead? I'm suggesting that this hospital has protocols and procedures that exist to protect patients from exactly the kind of unauthorized medical intervention that occurred in Emma's case, Dr. Morrison replied. While we're obviously pleased with Emma's recovery, we're concerned about establishing precedents that could compromise patient safety in future cases. Xavier looked up from his medical textbooks with an expression that carried the weight of someone who had studied systematic medical failure for years. Dr. Morrison, in the past 3 years I've documented 17 cases where Chicago area hospitals misdiagnosed treatable conditions because medical teams weren't willing to consider diagnostic possibilities that fell outside their standard protocols. Dr. Morrison's carefully controlled composure cracked slightly. You're claiming to have conducted unauthorized medical consultations at multiple hospitals across the city. I'm documenting systematic diagnostic failures that result from medical systems that value institutional authority over patient outcomes, Xavier replied calmly. And I'm prepared to present that documentation to any medical board or legal authority that's interested in understanding how many patients suffer or die from preventable misdiagnoses. Emma reached for her mother's hand, her improving coordination allowing precise movements that would have been impossible under her previous treatment protocol. Mom, I want you to know that Xavier has 17 families' worth of evidence showing that what happened to me wasn't an isolated incident. Grace Sterling looked at Xavier with new understanding of the magnitude of what he was documenting. Are you saying that systematic medical incompetence killed your grandmother and nearly killed my daughter, and that it's happening to other families right now? I'm saying that medical systems resist diagnostic insights that come from non-traditional sources, even when those insights save lives, Xavier replied. And I'm saying that until that changes, patients will continue suffering from preventable misdiagnoses. Dr. Morrison realized she was facing something beyond her institutional management experience. Documented evidence of systematic medical failure, a recovered patient with media support, and a homeless consultant whose diagnostic abilities had been publicly validated through successful treatment outcomes. The board meeting that would determine the future of medical accountability at Chicago General was about to reveal whether institutional power could survive systematic exposure of its failures. The emergency board meeting convened at 2 p.m. in Chicago General's executive conference room, where 12 board members faced the most serious challenge to institutional medical authority in the hospital's 100-year history. Emma Sterling, fully recovered and cognitively sharp, sat beside her parents with Xavier and Maya, ready to present evidence that would either transform hospital practices or be buried through institutional damage control. Board Chairman Dr. William Crawford called the meeting to order with the grim expression of someone whose profitable medical institution was facing systematic exposure of diagnostic incompetence. We're here to address the circumstances surrounding Emma Sterling's care and the allegations that have been made about our diagnostic procedures. Emma spoke first, her voice carrying the moral authority of someone who had survived systematic medical negligence. Dr. Crawford, I'm not here to make allegations. I'm here to present facts that can be verified through medical records, witness testimony, and documentation of treatment outcomes. She gestured toward a pile of documents that Xavier had prepared, detailed case studies of the 17 patients he'd tracked over 3 years, including medical records, family testimonies, and evidence of diagnostic errors that had been ignored or covered up by institutional authority. Xavier Brooks identified my condition correctly within minutes of examining me, while specialists from Harvard, Johns Hopkins, and Mayo Clinic had been treating me incorrectly for 2 weeks, Emma continued. The question isn't whether he was right. The question is why our medical system consistently dismisses diagnostic insights that come from sources outside traditional institutional authority. Board member Dr. Sarah Thompson leaned forward, studying the documentation with the concerned expression of someone recognizing patterns that challenged everything she'd believed about medical excellence. Mr. Brooks, these case studies suggest systematic diagnostic failures across multiple Chicago hospitals. Are you claiming that medical incompetence is widespread throughout our healthcare system? Xavier opened his primary textbook, the worn copy of Harrison's principles that had guided his medical education, to pages documenting successful treatments for conditions that mainstream medicine had considered hopeless. I'm documenting evidence that crucial medical knowledge gets ignored when it comes from sources that don't fit traditional educational hierarchies, Xavier replied. Dr. Elena Vasquez's research on atypical locked-in syndrome has been available in medical literature for 6 years, but it's published in journals that focus on indigent patient populations, so expensive specialists never encounter it. Maya stepped forward with 15 years of nursing experience behind her testimony. Dr. Thompson, I've observed subtle patient responses for years that suggested consciousness or awareness, but when I brought these observations to physicians' attention, they were dismissed as nursing staff lacking clinical expertise to interpret complex presentations. The room fell silent as board members processed the implications of what Maya was describing. If nurses were systematically observing symptoms that physicians were dismissing, then hierarchical medical structures were actively preventing diagnostic accuracy. Board member Marcus Chen reviewed Xavier's documentation with growing concern. These case studies show successful treatment outcomes when alternative diagnostic approaches were considered. How many patients might we have lost because we weren't willing to consider possibilities that fell outside our standard protocols? 17 families that I've been able to document personally, Xavier said quietly. And those represent only cases where I was able to investigate directly. The actual number of preventable misdiagnoses is probably much higher. Dr. Crawford felt the weight of institutional liability settling on his shoulders like lead. If Xavier's documentation was accurate, Chicago General faced not just reputational damage, but potential legal consequences from families who had lost loved ones to preventable diagnostic errors. What are you proposing we do about this situation? Dr. Crawford asked. Emma exchanged glances with Xavier and Maya before responding. We're proposing that Chicago General implement the Xavier Brooks Diagnostic Protocol, a systematic approach to medical consultation that includes perspectives from non-traditional sources when standard treatments aren't working. The proposed protocol was elegantly simple. Any patient who had been unresponsive to treatment for more than 72 hours would receive a multidisciplinary review that specifically included input from individuals who had studied medicine from personal necessity, who understood patient experience through living with misdiagnosis, and who approached symptoms without the preconceptions that sometimes blinded formally trained physicians. So you're asking us to hire homeless individuals as medical consultants? Dr. Thompson asked, her voice carrying disbelief rather than hostility. We're asking you to value diagnostic competence regardless of where it comes from, Maya replied. Xavier saved Emma's life because he understood locked-in syndrome better than your expensive specialists. How many other patients could be saved if you were willing to consider medical insights that don't come with traditional credentials? Xavier opened his textbook to a page documenting treatment outcomes that challenged conventional medical wisdom. Dr. Thompson, medical knowledge doesn't require expensive education. It requires paying attention to what patients are trying to tell you about their own experiences. Board member Dr. Linda Rodriguez studied the successful treatment outcomes documented in Xavier's case studies. The financial implications of this protocol could be significant. If we're preventing misdiagnoses and providing more effective treatments, we could reduce costs while improving patient outcomes. Dr. Crawford realized that the board was facing a choice between protecting institutional pride and implementing changes that could genuinely improve medical care. Xavier's documentation showed that alternative diagnostic approaches were not just theoretically sound, but practically effective in ways that could benefit both patients and hospital finances. We need time to review this proposal carefully, Dr. Crawford said finally. Emma stood with improving coordination, her recovery serving as living proof of what alternative medical approaches could accomplish. Dr. Crawford, while you're reviewing proposals, other patients are suffering from the same systematic diagnostic failures that nearly killed me. How many more families need to lose loved ones before this hospital decides that patient care is more important than institutional pride? The board's decision would determine whether medical innovation could overcome institutional resistance, or whether Chicago General would continue prioritizing reputation over patient lives. 6 months later, Chicago General Hospital unveiled the Xavier Brooks Diagnostic Protocol in a ceremony that attracted medical professionals from around the country and fundamentally changed how the institution approached complex cases. The protocol had already prevented an estimated $2–3 million in unnecessary treatments, while identifying and correcting medical approaches that had been actively harming patients. Emma Sterling stood at the podium in the hospital's main auditorium, fully recovered and preparing to address an audience of medical professionals who represented the same institutional thinking that had nearly cost her life. Beside her sat Xavier Brooks, now enrolled in Northwestern University's Accelerated Medical Program with a full scholarship funded by the Sterling Family Foundation. 6 months ago, I was a patient in this hospital's ICU, conscious but unable to communicate while medical professionals discussed whether my life was worth the cost of continuing treatment, Emma began, her voice carrying across an auditorium filled with doctors, nurses, and administrators from hospitals throughout the Midwest. Today I'm here to announce the results of implementing a diagnostic protocol that values medical insight regardless of its source. A protocol that has already saved lives and prevented the kind of systematic misdiagnosis that I experienced. Maya Washington, now promoted to Director of Patient Advocacy, stepped forward to present statistics that had shocked even the hospital's board of directors. In 6 months, the Xavier Brooks protocol had identified diagnostic errors in 37 cases, leading to successful treatment of patients who had been considered hopeless under traditional approaches. The most important change we've implemented isn't technical, it's cultural, Maya explained to the audience. We've created an environment where observations from patients, family members, and non-traditional sources are valued equally with formal medical opinions. This requires humility from our medical staff, but it's saving lives. Xavier was invited to speak about the theoretical foundation underlying the protocol's success. He approached the podium with characteristic quiet confidence, carrying the same worn medical textbook that had guided his education on Chicago's streets. 3 years ago, medical professionals told me that my observations about my grandmother's condition weren't valuable because I didn't have medical training, Xavier said, looking out at an audience that included many physicians who had previously dismissed insights from non-traditional sources. Today, those same types of observations are being used to save lives at one of the most prestigious hospitals in the country. The difference isn't that I learned more about medicine. The difference is that this institution learned to listen to people who understand suffering, not just people who understand systems. Dr. Robert Whitmore, whose career had been transformed rather than destroyed by his public acknowledgement of diagnostic error, stood to address the audience about the personal impact of implementing the new protocol. 6 months ago, I was forced to confront the possibility that my 30 years of medical experience had been built on false assumptions about the relationship between credentials and competence, Dr. Whitmore said, his voice carrying the humility of someone whose fundamental beliefs had been challenged and changed. Working with Xavier and Maya taught me that the most important medical skill isn't diagnosis, it's listening. And the Xavier Brooks Protocol has taught this hospital that healing requires more than expensive equipment and prestigious credentials. It requires paying attention to what patients are trying to tell us about their own experiences. The audience stirred with interest as Dr. Whitmore described specific cases where the protocol had identified diagnostic errors that traditional approaches had missed. Hospital administrators were particularly interested in the financial implications. Reducing diagnostic errors had not only improved patient outcomes, but had significantly decreased the costs associated with prolonged incorrect treatments. Emma returned to the podium, for closing remarks that would define her ongoing advocacy for medical reform. The Xavier Brooks Protocol isn't just about changing how this hospital practices medicine. It's about changing how we think about medical knowledge itself. She gestured toward Xavier, who had become living proof that diagnostic excellence could emerge from the most unlikely sources. Xavier's grandmother died from a treatable condition because medical authority was more concerned with protecting its credibility than with saving her life. My recovery exists because one nurse was willing to risk her career to challenge that authority. Emma paused, looking directly at medical professionals who still struggled with the implications of valuing non-traditional diagnostic insights. How many other patients are waiting for medical systems to value competence over credentials? How many families are losing loved ones because we're too proud to admit that healing might come from sources we don't expect? Xavier stood beside Emma, his transformation from homeless outsider to recognized medical consultant serving as proof that the protocol could identify and nurture diagnostic talent regardless of its source. The Xavier Brooks Protocol represents more than diagnostic reform, Emma concluded. It represents hope that medical systems can evolve to serve patients rather than protect institutional pride. And it represents proof that sometimes the most important medical insights come from people who have the courage to see what others refuse to acknowledge. The sustained applause that followed wasn't just recognition of successful medical innovation. It was acknowledgement that patient advocacy, diagnostic humility, and systematic reform could transform healthcare when institutions chose healing over hierarchy. Maya stepped forward for the final announcement. Chicago General had received requests from 47 hospitals across the country seeking to implement similar protocols, creating a network of medical institutions committed to valuing diagnostic competence regardless of its source. Thank you to everyone who typed "listen" and to all who shared their locations from around the world. Your support for medical equity means everything. If these stories inspire you, please subscribe to join our community fighting for fair treatment in healthcare. Until next time, keep believing in the power of listening to all voices.